Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. I have two gentlemen here, two doctors who are going to answer a lot of questions that you have brought to us. So here we are. In front of me is Dr. Jason Perry, who's an orthopedist and board certified in sports medicine. Welcome, doctor.
Thank you.
And we have Dr. James Ross. You're involved in sports medicine, and we want to talk about surgical or non-surgical options in the area. I know you both serve at Boca Raton Regional Hospital, the Orthopedic Institute, which is really growing. So welcome, doctors.
Thanks for having us. Dr.
Perry, tell me, although I made you an orthopedist, I know that you work in non-surgical sports medicine issues. So tell the people, what do you do?
So I'm an internal medicine, sports medicine doctor by training, but I don't treat internal medicine problems. After my fellowship, I decided that I wanted to strictly treat orthopedic problems in a non-operative fashion. So I treat anything from kids that have injuries to athletes, middle-aged adults that are injured or have chronic pain, and older adults with arthritis and musculoskeletal problems.
Really? Mm-hmm. And do you have a section in the hospital which collaborates with physical therapy and other entities that work with you?
Sure. So the hospital has a sports medicine department. We're part of that sports medicine department. We work closely with physical therapists. And we're also stationed at FAU and Lynn University, where we provide care for their athletes along with the physical therapists at the hospital.
Okay. And Dr. Ross, you're the operative orthopedic physician. Tell us about the institute, the Orthopedic Institute at Boca Raton Hospital.
Our Orthopedic Institute at Boca Raton Regional Hospital has grown tremendously. I've been at their department and at the hospital for just on 3 years now, and we've seen dramatic changes, not only in the sports medicine, but within the Orthopedic Institute. Dr. Perry is our medical director, as he mentioned, for our sports medicine program. Our Orthopedic Institute is very vast and diverse. We have multiple surgeons that have expertise to treat all types of orthopedic injuries. The vast majority of orthopedics is non-operative, both which myself and Dr. Perry treat, but if people need surgery, there's lots of surgeons that are around to treat all the different complex needs of patients.
I know that the folks who asked about this issue, not necessarily sports medicine, but it really fits into what I would call a sports medicine volume of responsible actions. We have a lot of folks who have asked us about injuries to children. You know, kids that are playing, you know, everything from flag football to Little League to whatever, and there's a lot of injuries. I wouldn't say a huge number, but we get a lot of folks that ask about it. And also, and then there's the issue, and I won't necessarily get into it, but there's a concussion issue that they bring to us all the time. But then you go way out the other side, and you got to remember that we have the largest number of people, percentage-wise, over the age of 70 in the United States living in the state of Florida, dominantly in areas like South Florida, the area that you serve so well. And people want to know, how do I, you know, I want a quality of life. So, I mean, I don't want to be sitting in a chair, and you know, I don't want to be in a situation where I can't stand up, or I can't sit, or I can't drive. And it all comes to the issues that I believe that you all deal with on even though you might not want to call it sports medicine involvement, but in essence, it's not any different. So let's talk about it.
Well, it's interesting. I think, you know, when people hear the term sports medicine, they think that they can only come to you if they're an athlete. But sports medicine and orthopedics encompasses a lot more. And as you were saying, there's issues that people deal with that are not sports related, chronic neck and back pain and osteoarthritis and joint pain that really impacts quality of life. And we treat all of that. We don't just treat athletes. We don't just treat people who are out there playing professional or amateur sports. We treat everybody.
And I think sports medicine, as Dr. Perry mentioned, is a very general term. I mean, that can mean anything for anyone. As you mentioned, little kids growing up and having overuse injuries, all the way to the middle-aged or older adult who enjoys playing tennis or doing water aerobics. I think there's lots of musculoskeletal problems and pain that can result from all these types of activities. And I think that is kind of what encompasses sports medicine.
Well, of course, you all know that we have one of the preeminent and longest, as far as age is concerned, osteopathic medical schools in the United States here, along with our new allopathic school, the MD school. And in discussing these things with the deans, myself discussing with them, I brought into the subject matter something that has happened at my alma mater in New York, Columbia University, that has for years done what we call non-surgical orthopedics. So let's talk about it. Good, Doctor, very good. You're the director.
So, from a non-operative standpoint, we treat a lot of the same exact things. And when people require surgery, sure, there's a role for surgery, but I don't have a percentage, 80–85% of things that are musculoskeletal, whether it be injuries or chronic pain, can be treated non-operatively and sometimes should be treated non-operatively before they go on to have surgery. We have a lot of techniques available to help people with their pain and their problems. Sometimes we're not fixing an underlying problem, but we're helping people achieve a better quality of life, whether that be with physical therapy, medications, injections, maybe changing your lifestyle up a little bit to stay active, but to avoid having more problems.
Well, that's an interesting thing. I want to, if you don't mind, I'll stay on that last sentence, or the last portion of that sentence. Stay active. Yeah. And we've had a number of colleagues of yours that have appeared on our shows for years, and we've gone from the open chop and block theories, and I don't mean to denigrate the issue, to now minimally invasive surgical techniques and avoiding surgery, as you just said. Now, that may not sit well with all orthopedic surgeons, but the reality is that we've learned a great deal more, I believe, and this is just my belief, that we've learned more about the whole body involvement. It's just not that one little section that's causing some problem, pain, or disability. What do you say about that, Doctor?
Yeah, I completely agree. To further emphasize what Dr. Perry talked about, it's a team approach to treating the patient. It's not just one individual in the course. I mean, you need multiple people to kind of touch hands on the patient and treat them not only from the initial evaluation, but to physical therapy, potential manipulations, things like that. Medicine in general is evolving and changing rapidly. The things that we have available for patients today for non-operative care is very well advanced and continues to advance. Regenerative medicine, which is the term of some of the newer techniques that Dr. Perry is employing, such as growth factor injections, platelet-rich plasma, or PRP, as some of the people have heard about. Stem cells is a very hot topic today. I foresee orthopedic treatment in the future having these modalities being a bigger part of the care of patients, and probably preventing surgery in patients that we jump to surgery for today.
The ability today in medicine to open up the eyes and really what's up here to the fact that everything is not what it used to be. It's not what you all were taught maybe 15, 20, 30 years ago, that medicine is advancing so rapidly. I mean, oversimplistically, I mean, little, minor, minimally invasive techniques which are used today, which are completely different. They're so different than what it was maybe 10 years ago, to the ability to have what you just said in the hands of Dr. Perry's cadre of individuals to, in essence, to try to treat the patient as a whole being, and recognizing that there's many, many more factors than just going and doing surgery. So let's carry it on.
Yeah, surgery has its risks, and people want to avoid surgery. Nobody, comes to the office wanting to have surgery. There's all sorts of risks involved with having infections and complications and prolonged pain, and maybe the surgery not even working. And if there's options for people before having to commit to a surgery that may help them get better, why not? And I think, as a medical community, whether we're fresh out of practice or 30 years out of practice, part of our job is to stay up to date and, keep up with what's going on and what's new and what is cutting edge in medicine. And this is becoming the cutting edge. It may not be perfect. I imagine in 10 or 15 years from now, we're going to be using PRP and stem cells a lot differently than we're using it today. And we'll have a lot more research and evidence, that guides us on how to use those products to treat people. And maybe a lot of the things that, like Dr. Ross said, are going on to have surgery won't need surgery in 10 or 15 years from now.
I want to stay on what you just said, but explain to the folks who are viewing this show what PRP is.
I'll let Dr. Perry
Dr.
discuss that,
Perry
since he's the expert.
So PRP, or platelet-rich plasma, it's a treatment called a biologic treatment because it comes from your own body. And it's essentially, the procedure is that you do a blood draw in the clinic, you spin the blood down to remove red blood cells and usually white blood cells and concentrate the platelets. And the goal is to concentrate the platelets 3 to 5 times the concentration of what's normal in the blood. And platelets contain growth factors and cytokines and all sorts of chemical factors that attract healing to an area. And that's how platelets work normally in our body. So the science behind PRP is that if we can concentrate these growth factors and proteins and cytokines and all these chemical factors in an area that maybe doesn't get good blood supply or is not healing well, that we can create a healing response or a regenerative response to an area that is already degenerative.
Let me ask you this, because it came to us, we did a show on athletics about a few months back, and one of the physicians was remarking about the use of PRP in professional football, all right? How the amazing thing is that somebody pulled a muscle or tore I don't remember exactly what, tore an Achilles or something, and they used PRP and the player was back in 4 weeks. Is that logical?
We don't have a lot of data with regard to the use of PRP for certain problems, and one of those being acute muscle strains or muscle injuries. The athlete's a different, it's sort of a different monster. It's like the geriatric patient or the pediatric patient. It's becoming a special population that we're treating. That's why I think sports medicine has evolved to becoming its own separate field within medicine. But the goal with the athlete is to try to return to play as quickly as you can, as safely as you can, but quickly. People want to get back in to have an impact for their team. And so PRP and the use of PRP, because it's so safe, has become employed to try to get these problems to heal quickly, to try to get people back into the game as quick as possible. Yeah.
Well, I was thinking back as you were talking. I was thinking back to that issue and that particular show, and it reminded me of something. And also with stem cells. Talk to me about stem cells. Who's going to talk to me about stem cells? We're going to look. You're on again, Dr. Perry.
All right. So stem cells. So stem cells is kind of a poor term, I think, right now, and actually, the FDA doesn't like us calling what we're using as stem cells stem cells.
Right.
You know, when we're gathering stem cells, whether it be embryonic stem cells, which doesn't come from your own body, or more commonly bone marrow type stem cells, what we're doing is we're employing a procedure in the clinic where we put a needle into the bone marrow and we suck out bone marrow. Within bone marrow, again, is growth factors and cytokines, and there's also stem cells. And similar to what we're using PRP for to create a healing response, we're hoping that stem cells does the same thing. You know, stem cells have the ability, as we know in medicine, to turn into other types of cells. Whether we're achieving that in the areas where we're treating, whether it be a joint, trying to treat, you know, cartilage loss, or whether it's in a tendon, trying to regenerate a tendon, I don't know if we're quite there yet in medicine. But the goal would be for that stem cell, from a physiologic standpoint, for that stem cell to turn into another type of cell and help regenerate an area of the body.
That's great. So now we get to you, Dr. Ross. We'll talk about, there are what I would call on the hit parade here. We've been doing this show now for well over 17 years, and the number one feature issues relative to the minds of the people out there are obviously cancer, heart disease, I would say general surgical issues, you know, and really it's the ability to have what I would call a useful life, all right? But the last two have they're sort of meshed, because all of a sudden now the fear of surgical cutting, a lot of blood, a lot of pain, a lot of hospital stays, long periods of time, have been diminished dramatically by minimally invasive techniques. And I think one of the areas where minimally invasive surgical intervention has been blossoming and been involved dramatically is in orthopedic surgery. So why don't we talk a bit about that?
Yeah, I couldn't agree anymore. I mean, that's why I chose sports medicine. Not only are you evolving and the field is changing rapidly, we're able to do different surgeries, but the minimally invasive manner is very attractive to the patient as well as to us as surgeons because of the outcomes that we're getting. So my practice predominantly involves mostly outpatient surgery. The vast majority of my surgeries that I do, patients go home the same day. I do perform surgeries at surgery centers, but also at the hospital predominantly, but they are able to leave the hospital the same day. So I do surgery of the shoulder, the elbow, the hip, and the knee, predominantly with the use of a camera, which is called an arthroscope. And with small incisions that are about the size of what you can fit a small pen into, I'm able to perform a lot of different types of surgeries. For instance, in the knee ligament surgery, if an athlete tears an anterior cruciate ligament, or ACL as it's most commonly known, we're able to do that and replace the ligament. But probably some of the newer things that we're doing within the sports medicine field and joint preservation field are disorders that involve the cartilage and the meniscus. So when patients develop cartilage disorders or cartilage loss in the past, really the only option was to try to deal with the pain and eventually get a knee replacement. But now I'm able to do techniques where I can actually regrow or transplant cartilage in the knee, again in a minimally invasive manner, for the patient to be able to keep their knee and prolong their knee for its longevity.
Also, there's a lot of questions, and of course I'm not going to get into the television ads, but there's so many discussions about the use of in spine surgical techniques, and I'm not going to get on that. That's as far as I'm going. But I know that there's a tremendous amount of minimally invasive techniques that have been approved and made. The use of these techniques have now become much more ubiquitous than they were almost less than 2 years ago. So let's talk a bit about that, because we get a lot of questions about that.
Yeah, I mean, I think that within medicine, as we mentioned before, things are constantly evolving. There's always new techniques. There's always new products. But fortunately, we have a governing agency, the FDA, that does manage different products and hopefully make them safe before they're employed into patients. But I think that as surgeons and as physicians, we need to be conscious about the supportive literature before deciding whether or not we should treat this with a patient. Me personally, I like to make sure that there's plenty of good sound evidence and good studies that have been done on different products before I start treating patients that way. But fortunately, as we mentioned, we have agencies and regulations that help prevent that from happening too rapidly. Just one example is most recently within the last year, a new FDA-approved cartilage procedure was approved. It's called MACI, Matrix Autologous Chondrocyte Implantation. And what that is for patients that have a cartilage defect in their knee, we can take a biopsy of their cartilage through a camera, send it off to a lab, and that lab will actually take that patient's cartilage and grow it up. In the past, what we had to do is we would get a solution back, and we would have to make a sizable incision, sew a patch in, and inject the solution underneath. But now what's been approved is they can actually send you a patch with those cells already built into it, and it can be done a lot more minimally invasive and to be able to implant it. Now, this has been going on in Europe for several years, but it was finally approved in the United States for use within the last year, and we're doing that at Boca Raton Regional Hospital.
That's great. I know this might be a bit beyond the orthopedic area, but we have so much discussion from parents and actually grandparents about concussion issues. I just wondered if some of that enters into your Orthopedic Institute questions.
Yeah, 100%. As the medical director of both universities and as being a non-operative sports medicine physician, part of my training was in treating athletes that have concussions. I see concussions in the community from high schools, from people that have had car accidents, and I'm the physician that sees all of the concussions at Florida Atlantic and at Lynn University. And so a big part of my practice is seeing athletes with these concussions and these injuries and diagnosing them and treating them.
One of the things that we had a couple of folks on, I guess about a year ago, one from the Dolphins and one sports trainer that works with us at our sports medicine clinic here at Nova Southeastern University. And they were strong on the fact that the parents and grandparents should pay attention, and that their grandchildren, they should be tested before they get involved, so that there's a marker. In other words, they were very conclusive in their discussions about it, and how as they advance, as they go from, these athletes go from whatever communal little league type of things to high school to college, how the records need to be viewed. Is that something that you would aspire to do?
We can. Baseline testing in concussion, there's a lot of different baseline tests that could be done. In treating somebody with a concussion, you don't have to have a baseline, whether that's a baseline symptom evaluation, baseline neuropsychiatric testing, baseline balance testing. There's a lot of things that we employ at the university to help guide us when an athlete has a concussion. It's helpful. It's not employed in the community yet. Some schools and high schools do it, not all do. I think that the guidelines out for concussion suggest that it can be helpful, and if you can do it, you should. But it's not necessary in treating athletes that you have a baseline.
Okay, well, I think that's very important. We're down to the last minute plus of this show. I want to thank you both for being here. I know that Boca Regional is going through what I would, of course, this is my observation, is going through a metamorphosis. A lot of things are changing. You have a new neurologic institute, you have a new, it's not new, but your cancer institute is growing. And obviously now the Orthopedic Institute is being shall we say, fortunately enhanced as things go along. So I think both of you should be privileged to know that we thank you as a community of South Florida. I think it's very important for us to thank the physicians. A lot of people, rightfully so, and unfortunately because of the recent issues in our community or our nation, we always thank our first responders. But you know, I was very, very much touched after this recent Marguerite Stoneman Douglas situation, when I knew that 2 of our graduates from Nova Southeastern were part of the surgical trauma team at the North Broward Trauma Unit on Sample Road. And knowing that, that these things are just naturally accepted when people go to hospitals. But I want to say to both of you, as just an individual that observes things for many years, I want to thank you both for not only your knowledge, but really I can feel the advocacy coming out of both of you. So thank you very much on behalf of the people that are watching this show. I wish you nothing but the very best. And Dr. Jason M. Perry, MD, and Dr. James R. Ross, those names haven't been called since you were in medical school, but you are both with the Boca Raton Regional Hospital Orthopedic Institute, and we really appreciate it. And be aware of the fact that you're always welcome to come down here. Anything that you might want to be doing in research or otherwise, we have a magnificent sports medicine program here. You're always welcome to come by. If you want to just view us, come by and view us. And of course, we have a team that's sitting right within yards of us here called the Miami Dolphins. And we do have a big sports program here, so as you all know. So thank you again both for being here today. Folks, if you have any questions, you have any comments, there's a telephone number and email address right here. Feel free to offer your thoughts. And remember, this show is your show. It's called Dateline Health. We come to you from Nova Southeastern University. My name is Fred Whitman. See you.